Once you have diagnosed your patient to be suffering from some sort of a strabismus or some sort of a deviating phenomena in the eyeball, and you have categorized your patient whether he or she is suffering from exotropia, hypertropia, or hypotropia, it is very easy to give out the treatment modality that can be effective in this particular case. On the other hand, a complete history taking is very important. That would highlight the causative factor, and treating the underlying cause is the mainstay over here. If the patient has stroke and that is developing into strabismus, you have to first of all treat the underlying cause to slow down or to basically treat the patient even purely to be suffering from strabismus. It can be a child, it can be an adult that you're dealing with. So it is also going to depend upon the child or the patient's age, how you're going to plan out the treatment modality in a particular case of strabismus when we talk about it. Eye patching is one of the favorites for the children. Whenever we have children to be suffering from strabismus, eye patching and some of the exercises can prove to be very vital for a better and for the good prognosis of the child management over here. Over here in this particular section of strabismus management, which basically starts off with the history taking, because you're running down or you're tracking down towards the causative factors and towards the risk factors of the development of strabismus in this particular child or in adults. So the assessments in the adults as well as in the children is discussed on separately. And again, we're going to keep in mind the different causative factors which are making the adults more prone, on the other hand, which are making the children more prone to the development of this particular disease process. The different treatment modalities, we'll be discussing them over here. The eye patches, the prisms are very important over here. On the other hand, we have the non-surgical and the surgical methods, and we have to compare the non-surgical methods with the surgical methods. And when we define or when we decide that we're going to perform these surgeries in a particular case of strabismus, what are the reasons behind that? What are the disadvantages for this procedure? And what are the typical kind of surgeries that we usually do perform for a lot of cases of strabismus? That will be defined over here. So talking about the assessment in the infants, the development in the infants, the newborn's eyes will typically move independently and even drift outwards. So it's a normal phenomena to see the infant's eyes moving or deviating outwards or inwards typically. Because they're not going to focus accurately on a lot of objects. The focusing of the objects would develop almost at about 4 months of age. By 3 to 4 months, infants should be able to focus on objects and eyes should be straight with no turning phenomena. Still, you're going to see and demonstrate whether the child is suffering from this deviation even after 6 months of age or not. So it's not going to be a particular diagnosis just right away. You have to wait and watch till the infancy period is over. 30 to 50% of the children with strabismus develop amblyopia. So it's again very important to keep in mind that if the strabismus is left untreated, it can develop into amblyopia, which is basically the poor development of the vision in the early childhood or in the early life stages of the life, which can again be very devastating for the child because it can result in the refractive errors which are high enough. So the most common in children at 18 months to 6 years old. So this is the most common time period. It can be treated during this time period. You can perform a lot of exercises. You can give multivitamins just to strengthen out the muscles in these children. So these particular treatments are inculcated to treat these children correctly and just to avoid any occurrence of amblyopia in these children. The visual acuity should be measured with correction 20/40 or worse. That is basically due to amblyopic conditions. Cover tests are performed in a lot of cases. Any measurable misalignment 1 degree is equal to 2 prism diopters, strabismus. Depth perceptions are also seen in these cases. Pteropsis test showing less than 100 seconds of arc caused by amblyopia or strabismus in a lot of cases. Then we have any refractive amblyopia, which can be observed in these children, is again very important. Any refractive errors that is sufficient enough to cause the amblyopia, that is basically an anisometropic amblyopia or hyperopic amblyopia. They're usually seen in these cases. Then we have the development in the adults, the most likely to develop as a result of injury or disease. Now, injury can be due to a lot of infectious or inflammatory causes. It can be due to any sort of a head trauma of an intensity which can cause a nerve damage. On the other hand, we have a lot of diseases. For example, if the patient is suffering from Down syndrome, or if he or she has a TIA, a CVA, or a stroke. Thyroid diseases are again going to be one of the causative factors for the development of strabismus in the adulthood. They experience double vision. The eye fatigue is very common with this phenomena, and they're usually overlapped or they are complaining of blurred vision. The pulling sensation around the eyes is very important, and there is a difficulty with reading, the loss of the depth perception. So all of these are going to be demonstrated whenever you are taking the history taking in this particular case of the development of strabismus in the adults over here. If loss of vision occurs, it is typically due to exotropia rather than amblyopia. So this is one of the facts that you have to consider, because the vision is already developed in the adult brain. So whenever we're talking about the children, it can be due to the loss of vision, can be due to amblyopia. But when we talk about the adults, the loss of vision is usually due to exotropia in these cases. The adult brain will not compensate for the deviation way a child's brain will. So this is one of the difference that we have to observe. So again, the treatment modality would be to treat the squint rather than that developmental amblyopic condition in that particular person that we're talking about. The diagnosis again would relate to a lot of factors. First of all, the history taking is the mainstay over here. You have to assess the symptoms, the health problems, and the medications in these individuals. The symptoms that the patient would be giving you would be the complaints of the decreased visual acuity, the occurrence of the double vision in the people. The health problems are again very important, and mentioning the strokes, mentioning the thyroidal problems, and if the patient is suffering from any kind of a medical condition, he or she would be taking a lot of medications along with it. Visual acuity, the measurements are taken to assess the extent to which the vision is affected. The Snellen charts are over there, and you just can demonstrate the decrease in the visual acuity in the patients over here. The refractive errors, if it's an anisometropic kind, you have to see the refractive errors in both the eyes and you have to compare them. Determine the lens power necessary to compensate for any refractive error. Alignment and focusing is very important. The eye health examination is done in detail just to enhance the different clinical signs and symptoms in these children. The assessing the structures of the eye, whether they're of the internal or whether they are of the external type in these individuals, is again very important. Now, when we move on to the treatment modalities that are available for the treatment of this squinting or the strabismus phenomena, the eye patching is the most favorite for all of the ophthalmologists out there. The outcomes are very nice, and the prognosis is very good in these children. The stronger eye is patched to force the brain to interpret the images from the strabismic eye. So this is the concept for doing the eye patching, and that is how the eye which is patched is basically the normal eye, and the other eye is used and is made functional just to make the brain to interpret the images from the strabismic eye as well. The eye patch does not change the angle of the strabismus. They're just going to lessen down or decrease down the amblyopic conditions in the children. By eye patching used only if the amblyopia is present. The eyeglasses or contacts are sometimes used in a lot of children, used to improve the positioning of the eyes by modifying the patient's reaction to focus and also redirect the line of sight, which can help to straighten the eyes in these individuals. So one of the ways is the use of specs the spectacles, the eyeglasses, or the contact lenses to lower down the refractive indices errors in both of the eyes. So to lower down the amblyopic conditions or the conditions which can lead to an amblyopia in a person. Prisms are used to modify the way light and images hit the eye. The lenses provide the comfort and help prevent the double vision from the developmenting phenomena. So this is one of the treatment modalities which we can observe in these children or even in the adults. Non-surgical methods of therapy that treat the eye and the brain, and optometrists will oversee the therapy which is designed to strengthen or overlap the visual skills. Again, the non-surgical methods would encompass the eye patching phenomena, the use of the contact lenses or the spectacles in such individuals, the use of different eye drops just to soothe out the images from the eye is one of the phenomena for the non-surgical kind of treatment in these people. Necessary to align the eyes by modifying one or more of the muscles in the eye. During surgery, muscle positions or length of the muscles will be changed due to this surgical procedure. So this was the causative factor, whether it is to strengthen out the muscles or it is to basically position the muscles and look at the length of the muscles. So this is what we are going to alter whenever we have these cases of strabismus at our hand. Surgeries may follow the period of eye patching. So it's not usually the case that we jump onto the surgical methods for the treatment of these cases. It's usually that we go in a step-by-step manner. We will perform the eye patches phenomena in these patients. We will move on to the use of the spectacles or the contact lenses. And then finally, if the non-surgical methods are not proving out to be good for the patient, then we are going to perform these surgeries after we have done the eye patching for such patients. Then the eyeglasses may be used after the surgery to treat the strabismus. So this is going to be a coupling phenomena. We have to couple up the eye patching phenomena along with the surgery, and sometimes if needed, we are going to use the eyeglasses just to treat the strabismus in the correct ways. So over here in this section, we just focus on the different treatment modalities out there to treat out these different cases of strabismus in different ways. Either it can be an esotropia, exotropia, hyper or hypotropia. The causative factors are very important. The underlying causes have to be dug out, and we have to just get the complete knowledge in a particular case, whether it is an adult or a child that we are dealing with, because amblyopia is not the concern when we are treating patients of an adult age group. Whenever we are treating patients of strabismus which belong to the childhood or the infancy age group, it's basically there that we concern with the amblyopic conditions which can occur or which can couple up or which can basically superimpose the condition of strabismus. So we're going to treat the amblyopia with the eye patching phenomena. Sometimes this eye patching is coupled up with the surgeries along with the use of the contacts or the use of the eyeglasses in these patients. So that is the end of this section. Thank you for watching sqadia.com.